Hey, I'm Teresa. I'm a dental hygienist. I've been doing this for 40 years. I had a really bad experience as a child in the dental chair. Was not very good at my home care. When I was 16 years old, and instead of my hygienist preaching at me, she actually taught me how to take care of my teeth. Through the years, I have learned tips of the trade. I'm going to teach you how to take care of your teeth and make your dental experiences a much healthier and happier place. Hey, thanks for watching the videos. Welcome back. I hope you're enjoying it thus far. Let's get started. Today we're going to talk about essential oils safe for children. We always remember the adults. Here's some things that you can help your children with. Let's get started. Okay, I'm going to go through, some of these are topical, some of these are going to be drinking, some of these are going to be rubbing on your skin, some of these are going to be with your diffuser. So I'll try to say what the herb is. You're going to hear these herbs for different things, but I'm just going to go through and say this is what it is. These are things that you can do. So acne is wild orange is really good for acne. You're going to take a couple drops and put it in 1 cup of water, and then you're going to wash your face with it just before you go to bed. Then we have anxiety. There's different ways that you can do it. You can do them in teas, you can do it in a diffuser. So these are the ones that you can put in your diffuser. The diffuser is going to be in your small diffusers. You're going to put about 3 or 4 drops of the essential oil in, and you're going to do it 20 minutes before you go to bed. And then you're going to do it 20 minutes before they wake up in the morning, and that'll help get them naturally relaxed and ready to go. If you have a large diffuser, you'll put 5 to 8 drops in. And you can use lavender, menthol, sweet orange, or basil for your diffusers, or a combination of them. Okay. The other things you can do, and these are ones that you can drink or make a tea out of them. Catnip is a sedative, chamomile is a sedative, menthol is a sedative, and sweet orange is a sedative. Now be careful with your menthol. Any child under the age of 30 months, you cannot use it because of the menthol in it. It can cause them to have breathing issues. They'll kind of gasp for breath. Also, some have been known to have seizures, so be careful under 30 months with that. If you're going to wear it, you can use any of these and wear them as well. You take 2 drops of the essential oil and put them in 2 tablespoons of the carrier, and then you're going to put it on your wrist or someplace, usually wrist or neck area. You can put them on your feet as well. Be careful because sometimes they can cause skin irritation. One of your carriers that you could use, for example, would be coconut oil. Next thing we're going to do is coals. And these are things that you can drink, and also you can use your diffusers with your menthol and your peppermints. That's good for your menthol. For breathing. But for colds, these things you can drink is frankincense is really good to help you make your coughs more productive. Elderberry can reduce the severity of the symptoms. Lavender can help with head colds. Lemon balm relaxes and increases circulation, and peppermint is good for sore throats. Again, peppermint, be careful under 30 months. For depression, basil, you can drink basil for depression. For diarrhea, cinnamon is very good for calming your system. Fever reducing agents, violet is excellent for fever reducing. For headaches, you can put these in your diffuser. Lavender, sweet orange, peppermint, ginger, rose, violet, and lemon balm. For your insect repellents, these are to put on topically, and how you do this is you're going to get a spray bottle, and you're going to put 2 drops of the oil, essential oil in. You can either do basil or citronella. Put 2 drops of oil into 2 tablespoons of the carrier, and then you can kind of spritz it on you or roll it on you. You can also take basil leaves directly and rub it on your skin. For insomnia, lavender. For your immune system builders, you want elderberry and rose. They're high in vitamin C. Vitamin C is excellent immune builders. They also have some other things in there to help you. To help with memory, to think clearly, and for us older people, age-related memory loss, basil, holy basil is one of the best things to use. Even kids that are having problems concentrating in school, try your holy basil. Mouth issues. If you're having sores in your mouth a lot, basil will help heal your mucous membrane and help soothe your mucous membrane. For stomach issues, you can drink these. Chamomile tea will help relax your stomach. Catnip will reduce the pain and the bloating. Ginger helps with gas. Peppermint helps with nausea. Rose helps with stomach problems. And lemon balm eases the pain from indigestion and improves your appetite. Wild orange, cinnamon, fennel, and violet. And violet helps with digestion, nausea, and cools and soothes. In respiratory, you're going to drink or put in your diffuser basil. Basil helps loosen phlegm. Your rose helps control coughing, and it's an antispasmodic. Lavender decreases chest inflammation. Peppermint helps with sore throats and coughing. Frankincense helps with coughs to be more productive. And violet cools and soothes inflammation. For your urinary issues, basil helps with your mucous membrane, helps soothe it. Other essential oils that are safe for children are oregano, coriander, cumin, turmeric, garlic, curry in the mild form, nutmeg, dill, black pepper, and thyme. For your bug spray in a bottle, 100 milliliters of water to 6 drops. You want to use it 6 months to 18 months. For toddlers 2 and above. For babies, you're going to put 6 drops to 100 milliliters of water. For toddlers, you're going to do 100 milliliters of water to 12 drops. And for anyone older, it's 100 milliliters to 18 to 36 drops, just depending upon their size. Put it in a spray bottle, spritz it all around. As I gave you in the formula earlier, you can also do it as a roll-on. Your essential oils, you can put these in a carrier. For 3 months to 12 months, you do 1 drop of oil to 15 milliliters in the carrier. The carrier can be coconut oil or another safe one for children. 1 year to 5 years old, you're going to put 2 drops to 15 milliliters in the carrier. For 6 years to 12 years, it's 3 drops to 15 milliliters of a carrier. And from 12 to older, it's up to 6 drops, 15 milliliters to the carrier. Okay, for a face wash, you do your 1 cup to 2 or 3 drops of your essential oil. Wash your face with it at night before you go to bed. Do not get it in your eyes. It can be very painful. Recipes for herbs. If you're going to use your dry herbs, you're going to use 2 tablespoons of your dry leaves, flowers, whatever they recommend that you use, to 1 cup of boiling water. Let it steep for about 10 minutes. Then you're going to strain it, let it cool, and then you're going to go ahead and drink it. For infants, it's 1 to 3 months, it's 1 ounce of tea. From 3 to 6 months, it's 3 to 6 ounces of tea. 6 months to 2 years is 6 ounces of tea. 2 years to 4 years is 2 teaspoons of tea. 4 years to 7 years is 1 tablespoon of tea. 7 years to 11 years is 2 tablespoons, and an adult is a cup of tea. Diffusers, your small diffusers is 3 to 4 drops of your essential oil, and large is 5 to 8 drops. Your roll-on, again, is 2 drops of oil to 2 tablespoons of your carrier. Just be careful that some of them can cause skin irritation. Your children's skin is not as tough as yours, so just be careful of that. Again, be careful of your peppermint menthol, because of children under the age of 30 months can have seizures or breathing issues. Make sure you're using the therapeutic grade oils, not your stuff that you buy over at your convenience stores. You want like doterra or some of the more quality oiled companies. If you have a small child or toddler or an infant, do not put the essential oils on their arms or their neck. You want to put them on their feet. That way they don't touch it and then rub it in their eyes or get it in a place that can cause irritation. No honey under a year, because of the bacteria in your honey. It can cause problems. Your willow bark. Do not use willow bark under the age of 18 or if you are pregnant. All you naturalists out there, willow bark has something called ASA, acetylsalicylic acid. That is the same thing as your aspirin, and that causes Reye's disease, and that is not a fun thing to do. For your anti-inflammatories to help your inflammation go down, you can use basil, thyme, rose, fennel, lavender, sweet orange, or turmeric. For your antibacterial, if you have any bacterial issues with your body, frankincense, fennel, lemon, peppermint, lavender, lemongrass, and garlic. For your antimicrobials is spearmint and peppermint. Your antioxidants are lemon balm. Your antiseptics are frankincense and lemon. And your antivirals are lemon balm, lavender, cinnamon, thyme, and garlic. Bacteria have a cell that is easier to break down. The viruses do not. They have a very thick cell and not very many things can get through. Most of your common colds and a lot of your symptoms are usually virus related. The symptoms usually last from 7 to 14 days. So your body is going to take care of things over time, but people will take a medicine and expect it to work. People will take the essential oils and expect them to work immediately. It does not. It takes about 24 to 48 hours for those things to start kicking in. I hope you enjoy the video. Floss the like button and don't forget to brush the subscribe. Thanks and have a great day.